Welcome back to Skin Goals. I'm your host, Lisa Avalos, and this is my co-host, Kelly.
Hey all. So today we have a very common topic that is almost a rite of passage for both teenagers and beyond and before. But it's acne. We've all had our fun with acne.
Yeah.
Love to share some stories. But before we get into a couple stories, we want to introduce our guest taking us through some acne today is our board-certified pediatrician and CeraVe consultant, author, podcaster, amazing mom, Dr. Whitney Casares. Welcome.
Thank you for having me.
We're so excited to be tackling the world of acne with you because so many people have questions from teenagers, parents of teenagers, to me as a premenopausal lady. Acne just is part of life, I guess, right? For a lot of us.
Yes, absolutely. And it really drives fear in our hearts. And actually, in some ways, for good reason, we know that acne can really be psychologically difficult. We know that there could be bullying as it relates to acne. We know there can be scarring from acne. And so it's an important topic to really handle. You know, we also all have our own stories when it comes to acne. Like, I remember having terrible acne. I remember having to take a lot of pills, a lot of things. And I remember using like really harsh scrubs on my skin. So our own internal dialogue about what it means to take care of our skin when we have acne is sometimes misinformed.
Yeah.
Yes.
And we're in a new era, so we have to re-educate ourselves and then educate families.
Love
For
that.
sure.
Love that. I know we were swapping stories. I know for me, hormonal acne, but also like if I work out, it's suddenly like I have that acne thing going on. So I have that. I know you were sharing.
Yeah, I had acne as a teen. Actually, maybe I started like in 5th grade and it kind of calmed down for a little bit. And then it came right back after college, like a crazy amount. Then it went away again. And now it peeps its little ugly head once in a while. So
yeah.
I just feel like it's my everlasting friend.
Yeah, totally. Me too. Sadly.
Yeah.
Well, you were sharing with me, Lisa, that when you first started having acne, you were talking with your pediatrician.
Yeah.
Was your source, right?
Yeah, that was my first step when I was in 5th, 6th grade, is asking my pediatrician, and then they put me on a routine. Of course, I wasn't consistent. And then, hormonal change. So then it happened again. So, but I always had a place to go ask, which was great. Actually, as an adult, I guess because I didn't know a dermatologist when I was in my 20s, I didn't know who to go to at that point in my life. But now we all know, go to dermatologists, for help. So
yeah, I love that. Actually, I think that pediatricians, we are a great resource. And sometimes people will skip that step and have unnecessary referrals or spend more money or use products that are more harsh or too advanced for their skin, especially when it comes to teens. And so that's a great suggestion, actually, is to talk to your pediatrician if you have acne concerns.
Yeah, for sure. Because I think we talked about this before, about how I've disrespected my skin before.
I like that phrase.
Yeah, just a lot of unnecessary exfoliation.
Totally.
And maybe not enough moisturizing because I'm thinking I need to counteract it. And that was not really going to like actual sound advice, just things I either read or heard on, when I was a kid. So I love that we're deep diving today. So my first question is that what's happening to the skin during those teen years that causes acne, that might cause acne? Not that everybody gets it, but some people do.
Yeah, so acne is really multifactorial and it's really common and actually really normal to have in the teen years, like we're saying, and at different points in our lives. It is the factors that really affect it are things like bacteria, sebum production, irritation to the skin, disruption of the skin barrier. So a lot of different factors that are at play. A lot of times people think it's because the skin is dirty or, no one's washing it at all or cleansing it at all. That's usually not the case. It's usually a lot of different factors, though we can intervene in terms of the cleansing for the teens for sure. The factor that I like to focus on the most is actually that skin barrier because there's a ton of research in this area And a lot of people don't understand how totally critical the skin barrier function is to making sure that we have healthy skin. We know that the skin is our largest organ. And so the better we can take care of it by taking care of that top layer of the skin barrier, the better. And we also know that when that skin barrier has the hydration that it needs, the moisturization that it needs, it's going to help to make sure that it's really healthy. And a lot of times there's this misconception when it comes to acne of, like we're saying, like stripping the skin or exfoliating or being too harsh with it. And then that's going to damage that skin barrier and make it even more difficult to deal with acne or potentially exacerbate acne.
Okay, so even if we are, like, I remember being a teen and not moisturizing and not putting on because I would want to dry it out. And that might not have been the thing to do, actually. So it's applying moisturizer. It's adding that to your routine.
Yes, exactly. Every single skin type needs moisturization. Whether you have more dry skin, less sebum production, which is that natural oil, or if you have more sebum production, have more oily or acne-prone skin. We all need moisturization. And for the teens, I like to keep this really, really simple. Have it be part of a routine. The other thing that every single skin type needs is protection from the sun. So we want to make sure, because we know that sun damage can cause even more irritation to that skin barrier. Again, now you're making it so that you have a setup for worsening acne, or making it so that you have even more side effects potentially from acne treatments that you're using. So sun protection and making sure that you're using hydration along with using a cleanser that's not going to cause more irritation. Those are really the keys.
So what you're saying is that even if someone has acne, they should be moisturizing and they should be putting sunscreen on, and that's not going to make things worse.
No, 100%. Yes. And you want to choose a formulation that's going to be comedogenic. And for different types of acne, there are different types of cleansers that I would recommend. So for comedomal acne, I recommend a 2% salicylic acid wash, because that's really going to help to clear and to prevent those whiteheads and those little blackheads. For those that have more moderate to severe acne, which is a few pimples to really inflamed pustules, a lot of that pus coming out, for those, benzoyl peroxide is going to be the type of cleanser that's actually going to be the most effective for that type of acne. So it really does depend on, you know, what specifically is your skin type, or what is the issue that's happening with your acne, what's the severity of your acne. But yes, it needs to be that everyone is using a cleanser, and every single person needs to be using moisturization.
Yeah. That makes so much sense.
It does. And I'm even kind of thinking, like, when you're in the pediatrician office, like for your routine physical or your school physical, like, it's a great time to ask, like, hey, like, what could I use for this? You know? It's,
Yes, absolutely. And really, the American Academy of Pediatrics and Dermatology, they all recommend starting with over-the-counter products first. They recommend starting with that routine first, with either using the salicylic acid or the benzoyl peroxide first, because we know that that's going to actually keep that skin barrier nice and clean, make it so you have a good setup for anything else that you might end up needing to use, depending on recommendations from your pediatrician or from a dermatologist.
That makes so much sense. And I think for me, when I was in that phase of life, is consistency.
Yes.
Because, I would do the routine, get nice and clear, and then stop, and then it would come back.
Yes.
So being consistent is another part.
Yeah, for sure. So 4 to 6 weeks of consistent use with an acne cleanser, with moisturization, and with the sun protection is really what we advise. Then if you've gotten to that 4 to 6 week mark and you're a teen who's 13 years or older, then using a salicylic acid control gel is something that can be useful. Again, you have to give that 4 to 6 weeks. So really important that we're talking to people about that irritation or that redness or that dryness, and that it could take a little bit of time for it to work. And then if at that point you're still having trouble, talk to the pediatrician about, is it the right time to start a prescription medication, or do they need to go to the dermatologist for next steps?
So as a parent, you're like marking the calendar on the fridge or on the chalkboard or wherever your calendar is, your planner, whatever it is, like, you're like, okay, like, just keeping track of like consistency and time.
Yes, exactly. And for that compliance, I want to make sure that we're soothing the skin as much as possible. I want to make sure we're hydrating because I know that some of the ingredients that are going to be, you know, in the BPO and in the salicylic acid can cause more of that irritation, more of that redness. So I want people to be consistent. And so that's why I really focus on kind of those accoutrements to treatment.
That's great. And that's a perfect time for a break. And we're back from our break. So I have a question for you. For all the parents looking for all the acne products out there, there's so many types. What are the most common and effective ingredients that they should be looking for?
Yes, absolutely. Great question. So salicylic acid and benzoyl peroxide really are the two. The basis of what we use for acne treatment. And we use the salicylic acid for that mild, more comedonal acne with the whiteheads and blackheads. Salicylic acid works by penetrating the hair follicle and the oil gland. And it is going to dissolve those acne-causing blockages from sebum, which is the natural oil, from debris, and from dead skin cells. So that's going to be really useful. And then benzoyl peroxide, it actually works by killing the bacteria that's underneath the skin, and then it can also help the skin by sloughing off dead cells and the sebum. And really, that's going to be used more for that moderate to severe acne. The products that I love the most in those categories are the CeraVe Acne Control Cleanser that has 2% salicylic acid. So that is going to be excellent for that mild, comedonal acne. I use that even on my own skin. And then the benzoyl peroxide is going to be great for that more moderate to severe acne. There's the CeraVe Acne Foaming Cream Cleanser, which is going to be useful. It's the 4% benzoyl peroxide. And then for 16 years and older, there's going to be the CeraVe Acne Foaming Cream Wash. And that's great for the back acne, great for that more severe acne. So those are really my go-to products when it comes to taking care of acne. And that's supported, again, by kind of the algorithms that are out there about what's the basic essential skincare for acne.
And you use that in the morning and at night. When do you use those
Yes,
products?
exactly. So twice a day in the morning and at night. And then while the skin is still damp, I want to follow it up with a moisturizer. And for teens, I want to keep it so simple. I actually prefer to use a moisturizer with a sunscreen in it. So the CeraVe AM Facial Moisturizing Lotion is the one that I go to. There's an SPF 30 and an SPF 50 now. It's so exciting. Yeah. So we want to make sure there's at least SPF 30, and we want to make sure that it has broad spectrum, which this one does. So this just keeps it so easy to have that routine, easy to make it so that teens know exactly what they're supposed to use, and it says AM on it, so they know that they're supposed to use it in the morning.
What about sports? Should they be cleansing after sports? How does that work?
Yes, 100%. So, and you can use the same cleanser after sports. So for sure in the morning and in the evening, but if you're sweaty, if you're getting a lot of oil or a lot of dirt on your face, then using these cleansers during the day is okay as well. Absolutely.
Okay, so here's the next question. You're talking with your kids and, like they're experiencing acne. How do you know whether you should just go right to over-the-counter, you should see a dermatologist, you should talk to the pediatrician? Like, which where do you start?
Where do you start? Yes. So start with the over-the-counter products first. That absolutely is the way to go. But if you're unsure about which over-the-counter product to use, talk with your pediatrician because they're not all created equal. It might say that it's gentle, but really it's an advanced skincare product that's not appropriate for that age group. So your pediatrician is skilled and knowledgeable in knowing what products are appropriate for what conditions. It can be confusing because there's all kinds of messaging and social media campaigns and sometimes even misleading information out there. So we want it to be that if you're unclear, you're going to the pediatrician first and that you're giving it enough time. So we need those 4 to 6 weeks of treatment before we figure out, okay, do we need to go on to the next step?
Is there an easy way to bring it up in the office? Because I'm just thinking even for like my preteen, my tween, or a teenager, it could feel embarrassing.
Yeah.
Like if a parent is bringing it up, is there a way that we should be talking about it with our pediatrician? Like, or is there a good way to bring it up? Like,
so one of the best ways to bring it up is just like I would ask in the pediatrician's office. As a pediatrician, I would say things like, are you brushing your teeth twice a day? Then sometimes I'll say things like, are you washing your face twice a day? You know, are you cleansing your face twice a day? And half the time they'll say no, or just with water, you know? So that's a great entry point. You don't have to say, I notice that you have a lot of acne. Here's what I would do about it, you know? By the same token, sometimes with my own girls, because I have an almost 8-year-old and an almost 11-year-old, I'll talk about just basic routines with them, and I'll talk about the why behind it. I actually think sometimes we don't give kids enough credit and teens enough credit when it comes to those who are experiencing acne about them being able to really connect what you're asking them to do and the why behind it. So really talking to patients about, we don't want you to have scarring later on. We don't want you to have dryness or irritation or more redness. We don't want you to have more skin damage. And so these are the products that we're recommending for your overall skin health and for where your skin is right now. That can feel less invasive or personal and more just about long-term overall health.
I love that. I love that recommendation.
I do have a question about acne scarring. We just kind of tapped around it right now. But what do you recommend about acne scarring?
Yes, the very best way to deal with scarring is to prevent it in the first place. And that starts by protecting the skin from sun. That starts by treating acne breakouts that do occur quickly and effectively, as fast as possible, with the right ingredients, with the right formulations, with things that are going to cause the least amount of irritation and disruption of that skin barrier. And the thing to not rush to is retinol. You know, this is something that I have 9 or 10-year-old patients asking me about in the office, and it's really not something that is appropriate. Ask for, I mean, it's fine that they're asking, but it's not an appropriate ingredient for them. And so again, ask your pediatrician, because they're going to be able to point you in the right direction as to what products that are over the counter are going to be helpful. And then also, if it's the right moment to take a step and see the dermatologist, or for them to recommend something that's a prescription level. But I don't want people to be rushing out and getting things like retinol on their own for sure.
Right. Because like you said in the beginning, it's a multifactorial, right? So like getting an expert advice and maybe not rushing to the retinols or you know, something harsh could be really good for, you know, that multifactorial part of it.
Yes, exactly. And you know, one other thing I was thinking about in terms of that discussion with the teens is, because we have so many preteens and teens who are on social media, who are seeing a lot of stuff about skincare, who are seeing tons of different brands out there, asking them from that standpoint, hey, have you seen anything on social media about skincare? What have you seen? Are there any questions you have about what you're seeing on TikTok, on Instagram, on YouTube? That can be a great way also to have it be really non-confrontational, but them to then say, oh yeah, I heard about this. I heard about that. What do you think?
They're part of the game plan.
Exactly.
Like, it's almost like a game plan going into the ped office and just being like, hey, like, what have you watched lately? Like, let's ask about that. That's cool.
Yes.
You know? So,
exactly.
Well, this was all helpful advice, and thank you for sharing it all with us and joining us and breaking down those acne ingredients.
Absolutely.
We'll see each other next time.